Good afternoon, everyone. Welcome to our Thursday edition of GoLocal Live here in the Navigate Credit Union Broadcast Center. I'm your GoLocal Live host, Rachel Nunes. Our first guest today is Dr. Ailis Clyne. She's here. She's one of the medical directors at the Rhode Island Department of Health and a pediatrician, and she's here to talk to us about the dangers of co-sleeping and the importance of safe sleep for infants.
Hi,
Thanks
Rachel.
so much for joining us.
Thanks for having me.
Let's start with co-sleeping. A lot of parents do it as a way to keep their baby near them and to feel safe both for them and for the child. But why is it so dangerous?
So at the Department of Health, we're really trying to get the word out on the safe sleep recommendations that come from the American Academy of Pediatrics. And among those recommendations are putting a baby on their back to sleep every time they sleep on a firm surface, and what we call sharing a room but not a bed. So having a baby sleep in the same room with a caregiver reduces the risk of SIDS, and sleeping on their own separate sleep surface and not on the same surface like a bed or a couch greatly reduces the chances that a baby might suffocate by accidentally being rolled over on or falling off of a surface that they're sharing.
And so you said sharing a room is good. At what point, how long should we share a room with the baby before putting them into their own room?
It's gotten a lot of attention in the press, and understandably so, because babies can be loud and noisy. Studies have shown that having a baby share the room with a caregiver in the first year of life can greatly reduce the chances of SIDS. We know that the chances of SIDS are greatest in the first 6 months. Now, the AAP recommendations do recommend that if at all possible, you share that room on a separate sleep surface for the first year of life. And if that's not possible, really critical in the first 6 months when we know the risk of SIDS is the highest.
So talking about co-sleeping, I know a lot of people say, oh, well, my mom did it, my grandma did it, they were all fine, and it keeps my baby close to me, it's easier for breastfeeding during the night. But there is that risk of the parent rolling onto the baby or the baby getting turned over. So it just should never happen.
Well, that's the goal, and we know that's not easy. Some folks have thought it over, and for cultural reasons and other reasons are intending to share a surface with their baby. Many times a caregiver is just exhausted and falls asleep and inadvertently finds themselves in that position. So, the recommendations actually call that out and say, we need to be talking to parents, we need to be talking to caregivers, and if they're feeding a baby and they're tired or exhausted, make a plan for where you're going to put that baby if you start to feel drowsy, or if you do nod off to sleep as soon as you wake up, getting the baby on their own separate sleep surface. You really do fall asleep really hard and quickly when you're sleep deprived and exhausted, and it's exhausting taking care of a newborn. So it's really the safety issue of accidental rolling onto the baby.
And is there any time where it is safe or recommended for you to share a bed with your child, or is it recommended to keep the baby separate, even as a small child?
Right. So the recommendations for a safe sleep environment are really pertaining to babies from birth to the first year of age. And so those were the studies that looked at what are some of the factors that are associated with what we call sudden unexpected infant death. That's really referring to the first 12 months of life.
So beyond that, it's okay.
Well, I think you need to look at every situation, independently, and there may be a risk for suffocation even in older infants. But when we talk about the safe sleep recommendations from the AAP, we're really focusing on those first 12 months of life.
And so talking about that safe sleep surface, there's a lot of different things that one day they'll say, yes, it's okay to have this, and then you're not supposed to have this. Yeah. And I know crib bumpers were very, very popular. They're really cute. You decorate your crib with them, but now you're not supposed to use them.
That's right. So crib bumpers and bedding like pillows, blankets, stuffed animals, soft objects are not recommended in the crib or bassinet, or if you're using a play yard. And the reason for that is, specifically with the bumpers, they haven't been proven to prevent injuries, and they have been associated with injuries and even, sadly, fatalities from a strangulation risk standpoint. So that's the reason why they're not recommended.
And so what about those blocks that seem to be popular for a while, that you kind of boxed your baby in with them so they wouldn't roll over? Is it better to just put them on the flat surface without it, or do those a risk as well?
Right, so what you're referring to are what we call wedges. And I feel like they were a little more popular maybe 10 or 15 years ago, and they were meant to keep a baby on their back when you place them down. But we also know that they can wiggle up, they can pose a strangulation or suffocation risk if they come up close to the face. And there have been, nationally, there have been accidental injuries and deaths associated with wedges. So again, not recommended. Put your baby on their back to sleep. That's the recommendation.
And so why the back and not the side, just for the risk of rolling?
No, actually. So studies of sudden infant death syndrome that went on in the 70s and 80s revealed that babies were less likely to die of SIDS if they were placed in the back position, meaning that the studies show that babies placed on their stomachs were more likely to die of SIDS. And later on, that research showed that even the side position was not as safe as putting babies on their backs. Now, we have a lot of theories, but we don't know exactly what causes SIDS, which is an unexplained death of a baby under a year old. What we do know is that back position is protective.
And so a lot of parents will say, oh, well, I think he looks cold laying there all by himself, just in an empty crib with just a sheet. What can we do to make sure that the temperature is regulated as well if we don't have the option of blankets?
Great. So you raise a good point, because one of the safe sleep recommendations is to avoid overheating in babies. But we also know that very small and young babies can be susceptible to low body temperatures. So the recommendation is to set the room temperature to what an adult would be comfortable in, and dress the baby in what an adult is comfortable in, plus one extra light layer. Now, a good option in lieu of puffy blankets would be something called a blanket sleeper, which includes the legs, can be zipped up, the arms can be free, or sometimes swaddled in very young babies. But it reduces the risk of strangulation if that blanket gets loose.
And the same with stuffed animals as well. I know a lot, as a child gets older, they'll often have a toy or those pacifiers with an attached stuffed animal for soothing. Is that ever okay? Is it okay to put your baby to sleep with a pacifier?
Right. So really, you want to follow safe sleep recommendations, which talk about when a baby is sleeping, so for naps and for bedtimes, you want to reduce the risk of any kind of suffocation or strangulation hazard. So that would include things like anything with strings, any puffy objects that the baby could roll over into. Some parents have that concern that the crib or the sleep surface, it just doesn't look fun. I want to see these items in there. And it's okay to have them in there when the baby is awake and supervised, but when you put that baby down for a nap or to sleep at night, just take them out and have a nice place to keep them while the baby is sleeping.
And so this isn't a new issue. It's been brought up a lot. I know about a year ago, you and DCYF were in the news for teaming up to come up with some ideas of what can be done to help decrease the numbers. And where are we now? Have the numbers gone down? Are more people aware? What's been done?
Right. So you are correct. About a little over a year ago, we started what we called the Interagency Safe Sleep Work Group. So it was staff from the Department of Health, DCYF, the Office of the Child Advocate. And what we first did was we looked around the country and we said, how are other states getting the word out? How are they getting the message to parents and caregivers? And we created a work plan, and we started training professionals who have close contact with children, DCYF staff, our family and home visiting staff, our WIC staff, early intervention. So we've really tried to reach out in that way. We've also been trying to raise awareness by working with each one of the 5 birth hospitals and working to get them materials in the forms of family-friendly handouts with nice pictures, but also giving out a board book. And I wish I had brought one with me, but it's a board book. It's a rhyming book about safe sleep. It's called Sleep Baby Safe and Snug. It's been used in some other parts of the country, and it's actually been studied and shown that it does have some impact on caregiver knowledge and even some behavior as well around safe sleep. When you ask about the numbers and where do we stand, sadly, we do have deaths in Rhode Island every year due to sleep-related deaths. And again, we're talking about babies under 1 year of age. We have seen since 2012 until now, we've seen about 5 to 9 cases of such deaths per year. And we are a small state, and sometimes it takes many years to be able to take a step back and see if what we're doing as an intervention is helping. So because of that, it's really hard to look on a year-to-year basis, and we kind of look in these 5-year snapshots. We're really hopeful that what we're doing will get the word out and that we will start to see a reduction in these fatalities.
Over time, has there been a gradual decrease, looking back at data from 10 years ago, 20 years ago?
Sure.
Are we on the decline?
Right. So if we look at the United States as a whole, and we compare the infant deaths from, say, 20 years ago until now, we have seen a sharp decrease in the total numbers of deaths. Now, most of those are in the category of what we call SIDS, and that's due to placing their babies on their back. So that Back to Sleep campaign was really effective. It got the word out, and people really followed and heeded that advice. So we've seen a decline. Starting about a decade or so ago, that started to level off. And what we have seen over the past 10 to 12 years is a very slow increase in those infant deaths due to suffocation, strangulation. And so that's why we really want to get the word out about the safety recommendations, especially as it pertains to that.
And so why do you think it's so hard to change people's minds? Do you think it's just a matter of, well, this is how I've always done it, or, you know, I co-slept with my first child and it was fine and he really liked the experience?
Right.
Why do you think there's so much research that shows that it's dangerous, and of course no one wants anything to happen to a child, so why do you think it's taking so long to get there?
Well, I think the first step is knowing about the recommendations, and so the first step is getting the knowledge and getting the word out there. And then the second step is really trying to give the rationale behind those recommendations. You know, why do they exist? We do know that through public health messaging campaigns, we can change safety behavior. Look at the infant car seats and the child car seats that we use now. We weren't using those 2 or 3 decades ago. So we know that it can be effective, it can take time, and especially when it comes to taking care of babies, and especially when it comes to sleeping, there's so many challenges that new parents face, exhaustion being one of them, but also sort of, you know, cultural understanding, hearing advice from family and friends, and seeing images on social media that don't always depict safe sleep environments. So, you know, there's multiple reasons why it may be challenging to kind of change the behavior, but we're going to keep getting the word out, and that's the first step.
Absolutely.
Right.
And so I know, speaking of social media, there's been a lot of buzz lately about, I believe it's in Finland, baby boxes.
Oh, yeah.
And how you're sent home from the hospital with this large box that's full of all sorts of goodies, and then you can use that as a sleep environment.
That's right.
Do we use those in Rhode Island at all?
No, and that's a great question, because one of the first things that our Safe Sleep Work Group did was take a look around not only our country but other countries, and take a look at what we might want to do here. So baby boxes are literally a cardboard box that usually can accommodate an infant in the first few months of life as a safe sleep item. They can be costly, believe it or not, and there's still studies going on as to whether or not they actually reduce the risk of SIDS or sudden unexpected infant death. Because of their cost, what we've done here is we've actually tried to promote local agencies to become affiliated with a national organization called Cribs for Kids, where they can purchase discounted play yards for slightly more than the baby box, which can accommodate a child even up to the age of 2 or 3. So the jury is out as to whether or not the baby boxes will be effective in this country in reducing infant deaths. But in the meantime, we here in Rhode Island thought that it was probably wiser to promote folks towards another product that would last longer, that we do know is a safe product to use.
Great. Well, thank you so much for taking the time to come in with us. It's a lot of really interesting information, and of course so important to get the word out there and to hopefully prevent any more deaths.
So back to sleep, share a room, not a bed, and try to have no objects in the baby's safe sleep environment.
They aren't cold, they're safe.
That's right.
Well, thank you so much, Dr. Ailis Clyne, for taking the time to speak with us today. We really appreciate it. Okay. And we'll be right back in just a minute with our next guest here on GoLocal Live in the Navigate Credit Union Broadcast Center.
Thank you.